The ESC of Northeast Ohio is pleased to provide the opportunity for educators and students to learn about the Northeast Ohio healthcare sector and careers in healthcare. This is through the ESC's partnership with Team NEO and its Connections to Careers workshop. The ESC of Northeast Ohio's Business Advisory Council gratefully acknowledges support for the production and distribution of this video for educational purposes. This video is the result of the ESC's 2025 Business Advisory Council Grant Award from the Ohio Department of Education and Workforce.
Welcome to Team NEO's Connections to Careers workshop. We think secondary and post-secondary teachers and faculty have an important role to play in closing that supply-demand gap. We hope that you can share that with your students and parents, and that we can get more people into these lucrative fields where they can make a great life for themselves in Northeast Ohio. I'm Julie Zeltner. I'm the Director of Talent Engagement with Team NEO. Team NEO is the region's economic development organization, partnered with Jobs Ohio, which leads the work through the state. I'm joined today by Catherine Gullett, the Executive Director of Case Western Reserve University's Center for Imaging Research. So next you're going to see a presentation from Catherine about what the center does. Thank you.
Thanks so much, Julie. I am Catherine Gullett, Executive Director with the Center for Imaging Research at Case Western Reserve University, or CCIR as we call it. We focus on biomedical imaging, which is any type of scan that you might be familiar with, like MRI, CT, PET scans, optical scans, ultrasound. Some of these may sound familiar to you. To start with a fun fact, the first X-ray in the United States was actually performed by Dayton C. Miller, who was a professor at the Case Institute of Technology at Case Western Reserve. Also, a Case Western Reserve engineering graduate won the Nobel Prize for the development of MRI. Our center started in 2005, and this is an image of all of the faculty members who are part of our center today. We are primarily in radiology and biomedical engineering, but imaging is a diverse field and touches many different parts of medicine. We have faculty members who are also in pharmacology, computer and data sciences, neurosciences, and others. In addition to faculty, we have many students who are part of our group. We established a trainee council that engages our students and our early career researchers so that they can meet other people from across the imaging research community and talk about their research and generate new ideas. Our vision at CCIR is to lead the next generation of transformative imaging research that will radically improve disease prevention, diagnosis, and therapy. We investigate many diseases and conditions using a wide range of approaches. Some of those approaches I mentioned earlier, and others are drug delivery, theranostics, and artificial intelligence. Diseases and conditions that we focus on include cancer, cardiovascular disease, neurodegenerative diseases, and others. This is just a snapshot of our most recent year. We have 57 imaging faculty and received $56 million in new awards. Publications were over 200, and publications are really important because that's how we disseminate our research. And we had 24 issued patents. Patents are an important step in taking a research discovery through the translation process into a product that can then impact patients. Zooming out from our center a little bit, in Northeast Ohio, there are a number of biomedical imaging companies. Some of these are well-established companies, and some of these are smaller startups that have started, for example, at Case Western Reserve. In addition, there are other companies that are based outside of the region, but have partnerships or collaborations with researchers here. The logos on the screen are the sponsors of our recent CCIR 20th Anniversary Symposium. There is a legacy of innovation in medical imaging in this region. One of the unique aspects of our ecosystem is the proximity of Case Western Reserve to 4 major medical centers, as well as medical imaging companies. There is also a lot of opportunity for growth, and this growth impacts patient outcomes and experiences. To give a couple of snapshots of jobs that are available in the healthcare and biomedical space, this website shows university hospitals' positions available. These could be home care services, laboratory and rehabilitation and social work, operations, or clinical care support, just to name a few. In addition, if you're interested in working in healthcare, but maybe don't want to work directly with a patient, or you don't like blood, then there are other positions available as well. For example, marketing and communications, IT, human resources, or accounting. These are some examples of positions at CASE. Some of these are entry level, and some of these may take years to achieve. For example, a research technician, veterinarian, research assistant, undergraduate researcher, postdoctoral researcher, administrative professional, like me, or professor. So what I want to share with you today is that the healthcare industry is broader and more connected than you may think, and it takes a variety of professions in order to make it all happen. I would invite you to visit our website if you're interested in learning more about imaging research, or reach out to us via our email. Thank you.
Okay, Catherine.
Hi.
Hi.
Thanks so much for having me here today.
Thank you for being here. We appreciate your time.
It's wonderful.
That was so interesting. I had no idea such a center existed. And when I learned about it just recently, I thought, what an opportunity to convey to teachers and faculty about what they can share with their students. How long have you been with the center?
I have been with the Center for Imaging Research for about 2.5 years.
Awesome.
But I have worked at CASE for almost 15 years.
Yeah. So when I first learned about the center and as a possibility of bringing this conversation to teachers, I was a little bit worried about the CASE name because it's so prestigious. But in talking to you, I've learned that there's opportunities for all kinds of people, even you and I, because what did you major in?
So my major was International Studies and French at Baldwin Wallace College.
Interesting. And I'm a history major from Cleveland State University. And here we are, economic development and in science research.
Yeah.
So I just want to make sure that teachers know that there's not just one way to get into this. There's lots of avenues. So I want to start with a question about why is Northeast Ohio the logical place for this center?
Well, Northeast Ohio has a rich history of medicine and healthcare, and also medical imaging. It is a very robust ecosystem here with the university, which is a research institution, and 4 major medical healthcare systems that are all very close, in very close proximity to the university. So clinicians and basic researchers can work side by side and stop by each other's offices. And we even have groups that are working really literally side by side. And so they can just stop by their colleague's office and ask a question that helps the research to be more effective. Clinicians are looking for basic researchers to understand the more technical aspects of some of the products or the techniques that are being used, and basic researchers need to have the clinical perspective in order to make their research projects and their discoveries more clinically relevant.
What was interesting also in your presentation was, I'm so glad you shared, like the private sector companies who are working in the ecosystem to advance. This is super important to an economic development organization, and that's that tech transfer, like all the research, how it gets out into the field. It's very attractive to other companies, because if there's an ecosystem already. Tell me about how if you do work directly with the companies, what does that entail?
Yeah, so many researchers who are part of our center have collaborations with companies, and that is to improve the products or to create new products that will then impact patient health. So, any product, any machine, anything that you have experienced as a patient has been a result of research. And so that research is done with the researchers at the institution, but then also in collaboration with companies.
Do you know, you may not know this, and I'm sorry to throw you a curveball, but how do you find the companies that are engaged in the work? Do they come to you, or you have to find them?
So I would say that it's a little bit of both.
Okay.
Certainly. Companies are also looking for connections with research to understand what's coming down the pipeline. They go to conferences to see the cutting edge research and what they might be able to incorporate into their work. And also, if we are interested in building a collaboration, and especially in the region, we would love to see more regional partnerships. And so if there are companies in the region, then it's more of an obvious fit, for us to collaborate with them.
Yeah, awesome.
And also from a talent retention perspective, we have students going through our graduate programs, and then of course we would love for them to stay in the region here. So the more we can encourage that, either by helping them find positions with companies here or also with startups. Startups are a big part of the biomedical research pipeline. And so, some students will go and work with a startup, or they'll be a part of a startup right from ground zero.
Awesome, thank you for that. And we work closely, Team ESCNEO and your center, to keep coordinating, new companies and new opportunities. So it's an important piece of the puzzle. What is the most exciting thing that you see coming in development about the field and its future?
So one of the most exciting things in imaging research is the opportunity for earlier and more accurate diagnosis. And imaging is just playing a big role in that. Something else that makes me really excited about imaging research is the opportunity to have non-invasive or less invasive procedures. So if you might have to, in a scenario, you might have to get a biopsy. Well, that's invasive. However, if you could have an image tell you the same type of information and avoid that biopsy, then that I would certainly be interested in that as a patient myself. So I think there's a huge opportunity and something that's really attractive to healthcare in being able to do non-invasive or less invasive procedures.
Yeah, I think that we could all agree that that's really important, and I think for ourselves and our families. And I think it'll appeal to students as well, because you're truly affecting health outcomes without necessarily seeing patients.
Absolutely. And another thing I would say is the prospect of machine learning and AI and how that is changing really so many fields. But in imaging too, there's a big opportunity and strides being made in applying AI and machine learning to images, helping clinicians and researchers see more deeply into the images, things that the human eye can't see. So if you're looking at a scan, it is providing a lot of information and information inside the body without having to cut open the body to look inside. But then an AI or a machine learning computer program can help you even notice things that you can't see with your eyes. So I think there are a lot of promises there in better accuracy, but also in more efficiency and speed for the people who are using the images as well.
That's exciting. How can a student figure out if they might be a good fit for this kind of career path?
It's a great question, because I'm sure that a student in ninth grade is probably not thinking about imaging research unless they know someone who's in the field. So of course there are many ways to kind of get familiar, job shadowing or volunteer opportunities and that kind of thing, aptitude tests. But I would say from what I would tell my niece, for example, would be that to be a researcher, I think you have to have a very strong sense of curiosity. So if you're the kind of person who is always curious and always wants to know why is it working that way, or how could we make it better, then I think that is, that's a quality of a researcher, and creativity too, because they're always finding new ways of doing things. We don't tend to research things that we already understand. We research things that are new to us, and we're looking for new solutions. So creativity is a really important characteristic as well. I think it goes along with really any field, but collaboration is a big key in research as well. And then things that you might expect, like attention to detail and resilience and perseverance. In research, you try and try again, and you have many experiments until you get the results that you're looking for, until you get the result that you can move forward. So having that character of being resilient and persevering would be, if a student recognizes that in themselves, I think that would be a good character for research.
Yeah. And I think teachers have the ability, because you've kind of defined it for them, to recognize that in their students and direct, students to this opportunity. What are some entry-level jobs in the field that, because we know definitely the researchers are sometimes advanced degrees, but are there other ways that students can think about getting into it?
Yeah. So some more entry-level positions would be, for example, a research assistant or a clinical research assistant. Radiology technicians are a more entry-level, MRI technicians. So there are ways for people to get started. Of course, you don't graduate and become a professor the very next day, but there are so many professions, so many pieces of the puzzle in order to make it all work. And for any student who's thinking about their career, there's of course aptitude and your skills, but then there's also what are your interests and what kind of work do you want to do, what kind of impact do you want to have. Right. And I know that students think about that, so I would just encourage them that even if you are not a doctor or a nurse, there are so many ways that you can have an impact on people's health by maybe being a mechanic on a piece of machinery, right, or helping with the IT or even communications for a healthcare system, or in our field and being a researcher.
Awesome. If anybody's ever had to wait to get an MRI image or something, we know that the demand is really high. So sure, how integral keeping that machinery up and running is super important, just to exactly your point, like quicker diagnosis, more accurate. So yeah, absolutely. I think you really put a good spin on that. What should students study if they're interested in imaging research?
Great question. So some of the subjects that come to mind are physics, mathematics, biology, a lot in the STEM space for sure. Also computer and data science, any kind of coding to tie in with the AI and imaging perspective. I think a lot of students are learning coding these days, but maybe aren't familiar with all of the applications, and so here's another one. Imaging research or imaging is an application of coding.
Neat, thank you. Are there any early exploration opportunities for high school students that you know of in this field?
Yeah, so I have seen high school students come to labs to shadow or observe and learn about research, just to kind of see what is a day in the life of a researcher. So there certainly are opportunities, and I would encourage students, if they're interested in that, start with an internet search, of course, why not? But then look up some of these bigger employers in the area and see what they have on their websites as far as opportunities for high school students. And there are summer programs and volunteer opportunities. So certainly, if someone is in high school and knows that they'd like to explore it, I would say there are resources out there for them.
Do you think you would, or you and or the companies would welcome the teachers also trying to create some pipeline between their schools and either the center or the companies? Like teachers could reach out and say, I'm looking for career exploration opportunities.
Yeah, I would love to talk with someone about that if they're interested in exploring that. We don't have a direct to high school program set up in our Center for Imaging Research, but there are opportunities at Case Western Reserve for high school students to get involved, and so I'd love to explore that more, because these are the researchers of tomorrow, and it's important that we engage them now.
Yeah, that's great. Hopefully some in the audience will take you up on that.
I hope so.
Where can teachers, parents, and students learn more about this field?
So I would encourage them to visit our website, and also I'm on LinkedIn and our center's on LinkedIn. I think that's a great place to learn about the professional opportunities, and people tend to post either jobs or volunteer opportunities and that kind of thing on the website there. And as I mentioned, some of the healthcare systems websites as well. I was really impressed to see just how many opportunities there were, jobs and education, and learn more kind of links on the pages.
So thank you, Catherine, so much for your insider information about careers in imaging research. I think that we all learned a lot today about a great career field, and hopefully if there's more questions, Catherine is more than willing to field those. And I will reiterate that if there's any interest in further research in this sector or others in Northeast Ohio, find me on Team NEO's website. I'd be happy to put in a research request for you. And lastly, I do want to thank the ESC of Northeast Ohio and the Business Advisory Council for this opportunity to bring this information to Northeast Ohio educators. Thank you.